is Congressman Case is here with an update.
Thank you very much. Thank you very much, Speaker and committee members, public listening in, aloha. Thanks for asking me to join you again. You all want to know what's going on in Congress with the next emergency assistance package, so I want to give you an update. As I understand it, of course, as we speak, we're in a very high stakes negotiation going on. Like I said, as we speak towards further emergency assistance. I don't think there's any question that there will be a further emergency assistance bill. That was, as you recall, the last time we talked, that was a little bit in question, but I don't think that's the question anymore. It's a very, very complicated negotiation. The complications, there are very, very clear policy differences in terms of what should be in a further package. Reportedly, 20 plus U.S. senators don't believe that we should have any further emergency assistance, and that's probably pro rata the same on the House side. So there's just people that are dead set against any further emergency assistance. There's clearly policy differences about what kind of further emergency assistance. There are clear political differences that are being, having to be dealt with in the context of a presidential campaign and congressional campaigns across the country. This has to be a consensus bill in order to pass Congress expeditiously. So in other words, all of the House and Senate, majority and minority and president need to line up before the bill even comes to the floor. This is not going to be a normal, pass the House and pass the Senate in a different form, go to conference, the president considers a veto. It's going to pretty much be lined up. So in some senses, you can think about this as kind of the lowest common denominator where everybody can agree that's what's going to pass. There's obviously negotiating differences. I think most of you have seen that the Senate and the president want to do a short-term extension of the unemployment benefits, which the House wants to do as well. But the danger there from the House's perspective is that nothing else would get done, and we'd only end up with unemployment, which is critical. But that's not the only critical thing that we think is going on. It's a very complicated negotiation. I just give this to you as an explanation, not because I agree with it. I'm disgusted with it, very disappointed. The House passed our HEROES Act 10 weeks ago, over 10 weeks ago, in the middle of May. We felt that emergency assistance for their packages were going to be necessary. The Senate majority introduced what they refer to as the HEALS package 1 week ago. So that was a lot of time wasted. And of course, we know that the federal supplemental employment benefits have now expired, should never have come to this. I can be disappointed, but that doesn't change where we are right now. So what I want to do is just give you the reality of the situation and give you my best guess as to where we're going. Quick refresher to date, somewhere around 7.7 billion to Hawaii now from the first emergency assistance packages. We're down to about 40 million that we have not received yet. So clearly, the well is just about dry as to the first emergency assistance packages. Possible areas of additional assistance: the Main Street Federal Reserve and Treasury lending program for really larger scale businesses that can't participate in the PPP. That's still out there, but as far as I can tell, many businesses across the country, including those eligible here in Hawaii, have chosen not to participate in that because they feel that the conditions don't fit their own business situation. PPP is technically still out there, but only 4 days left to apply. We talked about this at the last meeting a couple of weeks ago. Not a whole bunch of PPP loans are still being applied for here in Hawaii. So unless we extend that PPP or allow people to go back for a second bite at the apple, not much left in the PPP. From the unemployment perspective, which I'm sure is a critical issue for each and all of you, somewhere in the range of $2.5 billion now in unemployment assistance benefits in Hawaii, of which about 881 million were state unemployment benefits, but the balance were federal, 1.63 billion federal from the CARES Act funding, including close to 500 million in PUA benefits. So those, you recall, are benefits to those that traditionally have not been covered. And of course, the PUA program is one of the principal areas where state DLIR has had the greatest issue in terms of administering. It's a brand new program. But the unemployment benefits on balance have been critical, and they would remain critical. So to kind of give you a sense of kind of where we are in terms of negotiating parameters, if I can put it that way, between the Senate HEALS bill and the House HEROES bill and the administration, which is, I think, fair to say somewhere in between. There are areas of agreement which I would expect to be part of a package at the end of the day. There's additional funding for healthcare providers for PPE, certainly for mental health through SAMHSA grants, telehealth, nursing homes, some of the workforce protection areas. One of the big four from the CARES being the stimulus payments, the direct payments to citizens. The House and the Senate line up on that in terms of continued 1,200 direct payments. There's differences in terms of how it kind of rolls out and some of the conditions, but there's not a whole bunch of difference in the big picture that stimulus payments are appropriate. Education, some housing. So I don't want to say that there's nothing that we are in agreement. There is the base of agreement for emergency assistance in many areas. But on the really big issues, there is not agreement right now, and that is where the negotiation is being addressed most directly. The biggest picture is just the total amount. Senate is at about $1 trillion of emergency assistance. The House is around $3 trillion. The difference there is primarily aid to state and local governments. The Senate would not provide any additional funding. And by Senate, I say Senate majority, so the Republicans in the Senate. And when I say House, the House majority of Democrats in the House. Clearly, the Democrats in the Senate are aligned with the House on this and vice versa on the other side of it. They would not provide any additional assistance. The House would come up with around $875 billion of additional assistance to state and local governments, of which $4 billion would come to Hawaii in that scenario. There is in both bills some additional flexibility for the state and local governments to spend that money in a broader range of areas than under the CARES Act. The primary one of concern here being the ability to utilize that money to fund previously budgeted amounts that were short in terms of revenues. So that's one thing the state and local governments here have wanted. We have a big disagreement on Medicaid. The Senate has no provision, and the House would increase the FMAP and generally make Medicaid more available to those in need. PPE is a major disagreement. The Senate, second bite at the apple, which I think many people believe, myself included, is appropriate for those folks that have already applied and their benefits have been exhausted. So that's one area that I agree with the Senate on. The House doesn't have that, but would provide a little bit bigger flexibility for those that have not applied for PPP already, which is for Hawaii purposes, not particularly relevant anymore. And then finally, the big one, unemployment, which was where we're all tripping on right now. The Senate actually would extend the unemployment benefits, but only at $200 versus the House continuing proposed $600 through the end of the year. So bottom line, the areas of particular disagreement are really state and local government funding and unemployment. Now the tough one, to try to give you a sense of where I think this is going to end up. Educated guess, negotiations are tough. I'm thinking about this from the perspective of real needs across the country. I'm thinking about from the perspective of state and county governments urging the federal government on a nonpartisan basis to act in these areas. So there's a lot of pressure from both Republican and Democrat governors and mayors from across the country, all talking to Congress. I believe that there is, from a political perspective, a major motivation from folks that are going to vote in the fall to provide this additional assistance. I think that all adds up to a deal. I think that it probably, if I were to try to estimate this timing-wise, I would say, late this week, early next week, somewhere around that. And the Senate and the House would act very quickly at that point. We would be called back from the House side and the Senate to vote it up or down, and it would go to the president immediately, presumably be signed. I would guess that some of those benefits would be retroactive. So in other words, for example, the unemployment benefits, I'm sure that that's part of the discussion right now. I would think that there would be some provision for unemployment in there since the Senate and the House both want continued unemployment, but I would just guess that it would be somewhere between $200 and $600 just for this from a strict how do negotiations go. And as I've said earlier, I think there will be a stimulus payment. It's really hard to tell about state and local government funding. I would guess some, but nowhere near what the House has proposed. I guessed that to you the last time we were on the phone. And then finally, PPP and small business. I don't know what to guess at, in all honesty, there. I wouldn't think that there would be enough, that much additional specific to a PPP program. I think the real areas of focus would again be state and local government funding, unemployment benefits, and the stimulus. So that's my report. Obviously, I am happy to answer any questions. We remain on the job. In my office today, the major issue by far from Hawaii constituents remains unemployment benefits. I would guess that's 90% of the communications into my office from people that are in need. And I would say of that 90%, at least 2/3 is PUA related. PUA has just been a real problem to implement. So that's an area obviously for the committee to consider and for the state legislators and the governor to consider is again, how can that whole process be accelerated? One final thing before I get off, Scott, and I'm sorry to take so much time. One of the critical issues that state and local governments, state governments particularly, have talked about in terms of the unemployment benefit continuation is don't change the basic structure of the program. And I think that's an incredibly important issue that I and others have communicated back into Congress, because as we all know, it was an incredibly difficult process to jumpstart a brand new federal program off of brand new software and to get it all set up to start running itself. And so if you go in there and you change the entire way that federal program operates, you're gonna have to go back through that all over again. So I think there's a real sentiment in Congress to keep it very, very simple and comparable to the last time around. And I support that. Thanks. That's what I got.
Thanks for the update. Are there any questions from the members? Any questions?
Yeah, Speaker, hi, this is Eric King. I have a question.
Sure, Eric.
Yeah, thanks. Representative Case, just wondering, you talked about state and local funding. I know the CARES Act provided quite a bit, and that is within those governments. Is there a provision in the HEROES or the HEALS Act that would extend the deadline from the end of the year to 2021 sometime?
Yes, both the Senate and the House bills contemplate that the utilization of state and local government funding would be extended into 2021. The House goes, trying to remember what the time frame is. I think it's 6 months, if I'm not mistaken. The Senate is 90 days, so that's clearly a negotiation. I think it's well understood that state and local governments need this, the flexibility of utilizing this money over a longer period of time than the initial compressed. But let's recall again that when we passed CARES and all of the bills that were associated with CARES, it was always about a short-term, survival phase assistance, and it was always, at least in my mind, contemplated that we were going to have to come back for a second emergency assist. So therefore, those timeframes were compressed in the CARES, whether you want to talk about state and local government funding or PPP. And it was never contemplated that there was not going to be another round if, in fact, we didn't let COVID-19 quickly, which of course we did not.
Great, thanks.
Speaker, I have a question, Della Velati.
Yes, Stella.
Great to see you, Congressman Case. I know you've been a leader on some of the conversations with tourism and reopening. I know that we're probably far as a nation from getting anywhere near to reopening up in a broad way, but is there any updates on that issue of testing and being able to pre-test and what airlines are doing and what we can do here?
Okay, well, first of all, in terms of my efforts to give the state of Hawaii the authority to require pre-testing before anybody gets on an airplane bound for Hawaii, as I reported previously, the Federal Aviation Administration said we don't have that statutory authority. Go to the Department of Health and Human Services, and I've tried very hard to get an answer. They tell me that their answer is imminent. But my working assumption is they might say the same thing. And so therefore you would have to change the law in order to get that flexibility. I think that having said that, obviously the state has a number of tools to get to the same place, one of which, from my perspective, is a quarantine that's actually fully enforced. And so that's the direction I would think about this is, okay, fine, if we can't actually require a pre-test, then can we have a much tougher quarantine so that essentially we have the functional equivalent of that, whether it be status quo right now or the Alaska model, which I thought was a solid approach if you did not have that authority.
Are there other questions?
Hi, this is Wendy Laros with Kona Kohala Chamber of Commerce. And my question is about any assistance for small business. I know you mentioned PPP and you mentioned that it may or may not really happen with this package. And then also, if you applied before, are you saying that you don't think that the people that applied before and received it will be able to apply again?
Well, that's the case right now. The Senate proposal does have a provision that, again, I agree with, and I hope it is in the final package. It says if you applied for it previously and you ran out, and partly because you felt you actually had to spend it by June 30th, which was the original requirement, that seems unfair that you're told that the deadline to spend it is June 30th. The deadline got extended a little bit, but that doesn't mean you don't still need critical assistance going into July, August, and beyond. So I agree with that provision, and I think that would probably be. I don't want to guess at it because I don't know enough about exactly what's happening in the negotiations in that area. But I think that would be perfectly acceptable to a majority of Congress. And then, by the way, Wendy, I think you were the one that asked me the last time around about 501c provisions or organizations to include the chambers, and that is in the House version and is, I think, under negotiation right now to allow for a broader utilization of PPP funds.
Are there other questions or comments? If not, just one thing, Congressman, we do have a subcommittee that is working on tracking the CARES funds in Hawaii, and they've done a really good job in pulling together all the data for Hawaii. And if your staff wants to, I think it'll be online at some points. If your staff wants to monitor that, because it'll tell us what amount of the appropriation has been spent down in Hawaii.
Yeah. Doing that. I appreciate that, Speaker. We've been doing the same thing. We've also been coordinating with the state's federal programs department, sharing information, and the Hawaii congressional delegation, in particular, Senator Schatz and I, since we're both on appropriations and are definitely tracking the money from that perspective. We've all shared information, and I am perfectly happy to share what we've got with you. We've got it down to a pretty specific matrix of 70 some odd programs that we've been tracking pretty religiously right through. So that's where the figures that I gave you earlier come from. And similarly, we're happy to share that with you as well.
Okay, thanks. All right, the co-chairs are Lauren Name and Jill Takuda, so they'll probably contact their staff if they haven't done so already. Okay, but thanks for your report today.
Thank you.
Okay, take care. Okay.